Welcome to our exploration of a deadly virus known as Ebola, which causes hemorrhagic fever. Hemorrhagic fevers are a group of illnesses that affect multiple organ systems in the body, characterized by fever and bleeding. Ebola poses a serious public health threat, with sporadic outbreaks occurring in Africa. This virus can spread quickly from person to person and has a high mortality rate. Currently, there is no cure for Ebola, but early supportive care, such as rehydration with fluids containing electrolytes, can improve survival chances. It's crucial to understand Ebola, its causes, and preventive measures to combat this deadly disease effectively. In our second section, we delve into the different types of Ebola, showcasing that they are not all created equal. There are 5 identified species of the Ebola virus: Zaire Ebola virus, Sudan Ebola virus, Thai forest Ebola virus, Bundibugyo Ebola virus, and Reston Ebola virus. Each species has been associated with outbreaks in Africa, with Zaire Ebola virus being the most deadly and responsible for the majority of outbreaks. Interestingly, the Reston Ebola virus does not cause illness in humans and has been found in pigs and monkeys. These variations in virulence and disease severity are key in developing effective treatments and vaccines. In this segment, we explore the causes and transmission of Ebola. The virus is found in several animal species, with bats believed to be the natural reservoir, carrying the virus without becoming sick. Ebola is introduced into the human population through contact with the blood, secretions, organs, or other bodily fluids of infected animals such as fruit bats, chimpanzees, gorillas, monkeys, forest antelope, or porcupines. Once a person is infected, they can transmit the virus to others. Ebola spreads through direct contact with the blood or body fluids of a person who is sick with or has died from Ebola, through broken skin or mucous membranes, or indirectly through objects contaminated with the virus, like needles or medical equipment. Section 4. Risk factors. Who is most vulnerable? People who are most at risk of contracting Ebola are those who have direct contact with the blood or body fluids of someone who is sick with or has died from Ebola. This includes healthcare workers, family members, and friends of those who are sick. People who live in or travel to areas where Ebola outbreaks are occurring are also at increased risk. Certain behaviors, such as hunting and eating wild animals, can also increase the risk of Ebola virus infection. It is important to note that Ebola is not spread through casual contact, such as being in the same room with someone who is sick. Section 5. Prevention. Actionable steps to stay safe. There is currently no licensed vaccine or treatment available for Ebola. However, there are several things that people can do to protect themselves from the virus. Avoid contact with blood and body fluids. Do not handle items that may have come in contact with an infected person's blood or body fluids, such as clothes, bedding, needles, and medical equipment. Wash your hands frequently with soap and water, or use an alcohol-based hand sanitizer. Avoid contact with bats and non-human primates, especially those that are sick or dead. Avoid bushmeat. The meat of wild animals can carry the Ebola virus, so it is best to avoid eating it. Section 6. Conclusion. Awareness and precautions are key. Ebola virus disease is a serious public health threat. It is a highly contagious and deadly disease for which there is no cure. However, there are steps that people can take to protect themselves from the virus. By understanding how Ebola is transmitted, who is most at risk, and the steps that can be taken to prevent infection, we can work together to control and prevent future outbreaks. It is important to stay informed about Ebola virus disease. Listen to the advice of your local health officials and follow their recommendations.